What is the definition of low-grade embryonic mosaicism? Hi, this is Dr. Prati Sharma, double board certified OB-GYN and REI. With the advent of pre-implantation genetic testing, or PGT-A, for aneuploidy, we now have the ability, after in vitro fertilization and creation of embryos, to actually test these embryos to determine their genetic composition. This means looking at the 23 chromosomes and looking for even small abnormalities that can lead to failed implantation, miscarriage, or potentially an abnormal baby. Well, our testing has become very, very sensitive with the very specific and sensitive techniques that we do to identify these chromosome abnormalities, and as such, we're coming up with abnormalities that are unclear and potentially could result in embryos that are transferable even though they have a slight genetic irregularity, and this is embryonic mosaicism. This means that there are two cell lines that are found in the embryo biopsy of 2 to 5 cells that are removed from the embryo at the time of PGT-A. When an embryo is mosaic, the embryologist and the genetic testing has characterized a couple of cells that have potentially an abnormality and a couple of cells that are normal. And so we consider whether this is representative of the entire embryo. So when we talk about low-grade mosaicism, it means typically that the embryos have a single chromosomal abnormality and that it was detected in less than or equal to 30% of the cells. So a low-level mosaic with one chromosome that's abnormal and at the 30% or lower level is a very transferable embryo that has a high degree of success, slightly increased failed implantation rate, and slightly increased miscarriage risk. Now, as you get more abnormalities in multiple chromosomes and the degree of mosaicism increases to 40 and above 50%, then your risks are higher, and there's a higher risk that the embryo will not implant and that it could result in an abnormality or miscarriage. 40% mosaicism is kind of on the border. I always like my patients to see a genetics counselor to discuss the chromosomes that are involved, the level of mosaicism, and characterize the risk and the chances of implantation.